So for the introduction is, in this year, which is 2020, Malaysia faced a new phenomena, which is pandemic COVID-19. COVID-19 is the virus that comes from Wuhan, China. It was spread to the whole country, including Malaysia. The person who have the symptom of this virus, such as fever, dry cough, sneezing or tiredness, should able to get the medical attention. And the person who are the suspect of this virus need to be quarantined. They need to be quarantined in 40 days because the incubation period of this virus is 40 days. The number of the person who are affected of this virus is increasing by time to time. It is reaching to the thousand of the patient. It was include the person who died from this virus. This virus give a hard impact to the country of Malaysia, and this virus also give the effect to the development of this country. So that Mercy Malaysia make an initiative to face the pandemic COVID-19. Mercy Malaysia, also known as the Medical Relief Society Malaysia. It was founded on 16 September 1999. The founder of Mercy Malaysia is the Tan Sri Dr. Jamilah Mahmud.
So the first is sending medicine to help people in Sabah. So medical evacuations to Sabah for use to personnel on duty in Sabah. So by this hub, the staff can perform their responsibility perfectly because the equipment is fully complete. This is because of due to sufficient equipment to treat COVID-19 patients. With the help of Mercy Malaysia, the ship or the equipment will arrive in Sabah. The medical will be sent to hospital and also the clinic in Sabah. As we know, Sabah didn't have any complete equipment to treat the patients of COVID-19. So by this delivery will have a good impact on the area and the surrounding to prevent the further patients outbreak. So let's moving on to second point, which is Malaysia sending 112 voluntary medical. So based on the newspaper of Berita Harian, Sunday 29 March 2020, said that Medical Relief Society Malaysia, which is Mercy Malaysia, is sending 101 voluntary to help the organizations to assist the Health and Ministry of Health addressing the outbreak of COVID-19. Means here the Mercy Malaysia is willing to sending the 112 voluntary of doctor, nurse, police and also the defense to help the government or KKM to prevent the COVID-19. So this aid is to relieve the burden of health and to help helpers to add helpers to the medical team as they fear there will be short supply. All of these assistants are qualified and competent assistant in the fields. It's like doctor, nurse, just like what I said before.
The third point is Mercy launched pandemic fund for COVID-19. Mercy Malaysia launched pandemic fund for COVID-19 is to support healthcare system under severe pressure because of COVID-19 outbreak. There are several agencies that give fund to the Mercy to help fight COVID-19, which is RHB Bank donate RM 1 million to the Mercy. With the RM 1 million, the Mercy used for helping in health, and Mercy also used that fund to help underprivileged B40 and other vulnerable members of community. Dewan Perdagangan Malaysia China MCCC donates RM100,000 to the Mercy Malaysia for buying 200 personal protective equipment to support the frontline workers. The other agency also is, which is Etika, also donate RM1 million to the Mercy to buy respiratory aids to treat COVID-19 outbreak. Maybank also donate RM4 million to the Mercy in cash for the pandemic COVID-19 to support the healthcare system. That donation is used for by the protection of protective equipment for the frontline, such as the doctor, nurse, staff and the volunteers of healthcare workers. The fourth point is distributing RM19.5 million in medical aid. The Mercy Malaysia distribute over 19.5 million in medical aid, including the medical equipment, the personal of protective equipment PPE to the medical workers and non-medical workers, which is frontline workers. Donation is corporate from public donation, including the largest donors, which is Association Inner Bank Malaysia (ABM) and Maybank. They use that money for distribute the healthcare equipment such as face mask, face shield, shoe covers, hand sanitizer, set hygiene kit, gown isolation and others. That fund also used for the critical medical equipment such as ventilator, infusion pump, vital sign monitor and ICU monitor.
So let's move on to the third point, which is launch of Ramadan Appeal Initiative. So during COVID-19, after government announced the continuous of COVID-19 until Ramadan, so many people didn't have or people no current financial status, which is they have no salaries because of they lost their job and then maybe they're working from home. So the salary is maybe like 50% rather than the last payment they get. So when this happened, the Mercy Malaysia have initiative can raise funds to help people in need, especially family who is very facing different Ramadan. So the fund is to raise or to buy their food and necessities of their needs, daily needs. Family with a greatest need for help from low paid, unpaid and retired family. If the movement control is extended again, they will affect more families in this country. So those who has to work hard and maybe still have income, they still have to diet or maybe budgeting their food. So once this happens, people can save money. Also, if they still have a job and still have funds or still have financial, they need to save their money. Those who those people who can save money can also reducing gasoline to them. So by saving of this, they can achieve because they do not eat outside and have a social unstable. This will show that the Mercy Malaysia do is really good, because they are just not only save the society but also the government, because they can ease the burden of government in helping the people financials.
So as the conclusion is, all the initiative that have been taken in Mercy Malaysia, which is sending medicine to help people in Sabah, sending 112 voluntary medical, launch pandemic fund for COVID-19, distributing 19.5 million in medical aid, and launch of Ramadan Appeal Initiative can help Malaysia to face the pandemic COVID-19. Other than that, they also can help all the frontliners, such as give a donation of equipment, food and so on. They are very helpful in getting the donation from others country to to fight this pandemic COVID-19. Besides that, it also can help to recover the country's economy and help in the development of the country indirectly.